you are coming to supplement with iron, do you go, okay, I'm going to try and do it through dietary here versus the intake and when you're optimizing gut function?
Why is this person not getting enough iron? So is it because
Hi, everybody, and welcome to the Kidney Coach YouTube channel. I am naturopath Fiona Chin, co-founder of the Kidney Coach and Kaigenesis, a range of supplements that we have specially formulated and designed for people with impaired renal function. And I'm joined again today by one of my favorite people in the entire universe, the lovely, the wonderful, amazing Lindsey Zirker. Lindsey is a brainiac, and as well as being a brainiac, she's also a renal dietitian, and she works alongside Jessie Anna Seville at the Kidney Nutritional Institute over in the USA. My friend, tell me iron. Let's dive down the rabbit hole. What do people with chronic kidney disease need to know about this amazing mineral?
well, kind of, I think the thing to start off with, which is what I was mentioning to you right before we started, is that iron and anemia, they're very much linked, but like there are separations in kidney disease.
Mm.
And I think that's really, really important for our people with kidney disease to understand, because um, anemia isn't always caused by an iron deficiency, although it often is.
Mm.
And also that iron deficiency isn't always caused by just not eating enough iron in kidney disease, also. And so I think it's important to understand that. And I was thinking about iron earlier today, and I was like, I feel like iron is like someone that has really, really extra controlling parents. Like, right? Because the hormones, we've talked about this before with minerals, a lot of times hormones are running the show. They are determining if this nutrient is going to get absorbed, how much is released into the bloodstream, how much is going to be stored. And with iron, I feel like that control is even tighter. And it's just like parents saying, no, you are grounded. You will stay in your room. The iron's going to stay in storage. No, you cannot have friends come over. No more iron will be absorbed. And all these kind of things. And I think that that's an interesting way to think about iron, because a lot of times it gets oversimplified and we miss the root issue going on with people's iron.
When you are coming to supplement with iron, do you go, okay, I'm going to try and do it through dietary factors first? Or are you looking at the diet and going, actually, that should be okay? So that's a gut absorption issue. Walk me through your process about supplementing with iron, what type of iron you supplement, when you would go diet versus actually supplementing with iron, and when you're also thinking the gut might actually be the issue here versus the intake and when you're optimizing gut function.
Yeah, I think it is really important to be asking, why is this person not getting enough iron? So is it because they're not getting enough from their diet, or are they not absorbing enough? So that's where, I take a look and, have them keep some food logs, and we see like what's going on there. And I think, the we have the recommendations for how much people with iron need. And of course, it gets kind of complicated if you're male or female, menstruating or not, if you're fully plant-based or not. Like there's going to be different iron needs. But you can, to see if it's like, oh, you're getting 5 milligrams of iron a day. Like that's just not going to be enough for anybody. So I take a look at that and see now if somebody, I look at their food logs and it says they're getting, say 15 milligrams of iron from their diet, but I'm seeing really low levels, then I'm definitely going to be asking myself, is this an absorption issue, or is this an increased needs issue? And
Mm.
so you're just going to have to be asking yourselves a lot of questions. I feel like one of the great gifts of being a good practitioner is being curious. Why is this way? Okay. And you just kind of keep looking upstream. Well, why is this doing this? Is it because of that? Um, and so, like just the other day, I had a transplant patient tell me that she woke up one morning and where her incision was, she had this huge bruise.
Oh.
And But right before that, she'd been telling me, yeah, for some reason my hemoglobin levels have been dropping and all of a sudden they popped right up. And then she told me she had that bruise. And I was like, well, what happened when you called your doctor about the bruise? It's like they took me off my Eliquis, my blood thinner. Suddenly her hemoglobin levels are better and the bruise is gone. And so that's a situation where, like, oh, this person's hemoglobin levels are dropping. They should have been asking why. And if they had done any kind of ultrasound or imaging, they would have been like, you're bleeding internally. Like, let's get you off this blood thinner. Luckily, it worked out for her anyway. But I think asking yourselves why that's happening is really important. And, you know, if it's gut issue related, usually there's probably going to be some other symptoms, like lots of gas or bloating or heartburn or things like that. Or maybe they're on medications that lower stomach acid. That's going to lower your ability to digest iron. Maybe you're eating too much what we call non-heme iron, so the absorbability of the iron is very low.
Mm.
Maybe you have a vitamin C deficiency, and so those two combined, that's an absorption issue that's not necessarily a gut problem per se.
Yeah.
So I think it's really important that the practitioner can think through those things. And I think as far as like, am I going to go food first? Am I going to do supplements or whatever? I think that the biggest factor in telling me with that is going to be how severe are their symptoms.
Mhm.
Because I've had a hemoglobin of 9.6 before. It was
Oh,
very
wow.
unpleasant.
That is
I did
low.
not feel good. I was
No.
always out of breath. I was so tired. I was so cold. Like, I know what it is like to be really, really anemic. And
Mm.
I think that when you have experienced it for yourself, you see, like, you understand the major quality of life issue that it is. Like, and I think that too many practitioners, they don't understand that. And so they're like, oh, well, it's not that low. You're fine. And it's like, you don't understand what that is like. I do,
Mhm.
so I am very like, let's see what we can do to reasonably raise these levels up as quickly as possible so that you can feel like a human person again. And
Yeah.
I think the other thing too is that if you don't have enough iron in your body, then it's going to be very difficult for oxygen to get anywhere in your body. That is
Mm.
just going to have a cascading negative effect on everything.
Mhm.
And so I tend to not be too conservative with my recommendations for anemia. Like I want it to be reasonable, but I feel like a lot of times, like I'm not going to say, oh, let's just add a couple iron foods and see how that does. If they're already showing, like if it's showing up in their labs that they're deficient, I'm not going to just say add a couple foods here. I'm going to say, let's add this supplement so that you can get a bunch extra so we can get you up to a normal status, then retest. And when things look normal, let's make sure that during that time we've also been building up your diet so that hopefully you don't need to have that supplement. But I just don't think that it's very fair for people to wait in that sad quality of life space and we can do something about it.
If you want to have Lindsey on your chronic health disease team, I'll put her details in below, but you'll find her at the Kidney Nutritional Institute. Lindsey and the team are based in the US, so that means with insurance, they can telehealth you anywhere. And if you're anywhere in the world, because of also telehealth, you can also chat to Lindsey anywhere in the world. So if you want to know more about that, I'll put Lindsey's details in below. If you want to know more about what we do, head to www.kidneycoach.com. You'll also find us on Instagram and Facebook under the same names. Make sure you hit subscribe and like. That way you'll get notified anytime we put up more content. Lindsey, thank you as always for sharing your wisdom, and for everyone listening, thank you for being part of our community. We appreciate all of you.